Bulavinaka, Namaste and good evening. I'm Vijay Narayan and you're watching Fiji Village Straight Talk live right from the home of Fiji Showcase 2026 here at the Vodafone Arena at the internal entertainment stage, and in a town hall fashion we will be doing this more often. Of course, this show, as you know, it started off with making sure that we get the issues that matter to you, the people of Fiji, first to you, on you knowing what the issues are about, you understanding the issues, you participating in the discussions, and also our job to get the people at the table to tell you what is happening. One of the biggest issues in our country, HIV. One of the most important priorities that any government should be looking at is the health of the people. And that's what we will be discussing today. And I'm grateful to have Dr. Jason Mitchell, Chair of the National HIV Outbreak and Cluster Response, and Dr. Emali Druma, the lead for HIV prevention community-led program, here with me. The experts, they've been working hard day and night, and there's a lot to be discussed. So Dr. Mitchell and Dr. Druma, thank you very much for joining us tonight. And also, we'd like to welcome those who have taken out their time to come and watch this show live here. You still have time if you want to come and participate in the discussion. And also those who are watching this show live right around Fiji and around the world, Bulavinaka to you. Now, Dr. Jason, the latest Fiji HIV surveillance report says we have more than 2,016 new HIV cases in just 1 year, and a cumulative total of nearly 6,000. You yourself have warned it could be over 9,000 HIV cases in a small country like Fiji. Are we past the point of controlling the rise of the cases?
Naka Vijay, and thank you so much for having us on the show tonight. The statistics, of course, really alarming for us. But whether we're on top of controlling the epidemic or not is very difficult for us to tell. We do estimate that with the current interventions that we have in the country, by 2029 we can expect to have up to 25,000 new HIV infections in the country. So it's significant for us. We need to do a lot more about our prevention interventions in the treatment and care. And if we don't attend to that very soon, then it will become a situation where it's out of control. But I think there's enough prevention happening at the moment, and enough treatment going on that we're able to sort of keep the epidemic in some control.
Dr. Emali, are we past that controlling point based on the rise of the cases?
Thank you, Vijay. I would agree with what Dr. Jason has said. I don't think we are past that time to control. We still can control, but we know that our approach needs to change. We cannot do business as usual, like Dr. Jason always mentions. And what we were doing in the past, we know it's not working. We need to change our approach, and if we don't do so and change as soon as possible, we'll get there sooner than we expect.
That's already very worrying in terms of making sure that we are controlling and we're doing the right things, because the clock is ticking. You did over 92,000 tests of HIV for last year. That's a high jump. Is the massive increase because of the high number of tests? From your perspective, did we do enough tests?
I think it's always an interesting question to answer, because oftentimes we do a lot of testing, but we're often testing the wrong people. And what we saw from our statistics around testing, that we've spent a lot of resources testing a lot of people who probably should not have been tested. So to answer your question, did we do enough testing? We did a lot of testing, but we spent a lot of that testing on the wrong groups of people. For a country that's limited in resources, we need to be better and more scientific in the approach that we do for our HIV testing. And that's something that we are going to get better at in moving forward. One of the things that you need to understand the epidemic and who is at risk and who's most vulnerable, and that you spend your efforts testing those groups of people. Otherwise, you're using limited resources to test all the wrong people. And these people are going to be negative. So what we've found is that what we call a positivity rate, so the number of people who are tested that end up being positive, and it's 3% for last year. We want to have a positivity rate of above 5%. So we have 2% to go in which we are satisfied that we're testing the right people. Now, 5% is the minimum. You want to always be testing people higher than 5%, which means that you're testing the right people and your resources are being used in the right place with the right people. Because then you're getting all those people who are positive on treatment, and then you put them to treatment. Treatment is a form of prevention. So for us, it's an important investment in being scientific in the way that you do HIV testing. Because currently, there's this belief in Fiji that you just test everyone, and everyone should just have a test. This is a very large country, and we have limited resources, and so we want to make sure we're testing the right people, and the right people are put on treatment as soon as possible.
Are we testing enough?
I would say I do agree with Dr. Jason as well, but this also shows the level at which we have expanded our testing services. We are not only focusing on our health facilities, we are going out of the health facilities into our communities. We are involving our partners, our NGO partners as well. And I do agree, it's not about how many tests we do, but it's about testing smarter. So we need targeted intervention, targeting testing that we need to do with our communities.
Now, do we have a situation where the virus is spreading faster than your testing?
Difficult for us to say for sure, but with the way that the HIV infections are happening in the country, and the fact that our testing is not as targeted as it should be, it's difficult for us to say whether the rates of infection are happening really quickly. We do know that the way that we are infecting each other in this country is very rapid, and it's because of the way that we are actually infecting each other. And a lot of it is to do with our cultural practices, and that is contributing to a rapid rise in HIV infections. So I think that's probably the best way to leave that question.
You use the term rapid, and we have an epidemic.
Mm-hmm.
For people watching this would be concerned.
Mm-hmm.
It's rapid,
Yeah.
and it's an epidemic though.
Yeah. I think we've done a very good job in highlighting the epidemic on the ground, and I think we've raised concern about the way that we are infecting each other and the way that the transmissions are happening. Our concern oftentimes is that we're not getting enough people on treatment, we're not getting our prevention interventions out there. There are a number of prevention interventions that we can have access to in Fiji, but some of it's not currently here. And so for us, there's always that concern we could be doing more in order to prevent the infections from getting worse. So it's definitely an epidemic that is explosive, and that's the way we're describing it. And the way that the rates at which the infections have happened, like I remember the times when we were talking about hundreds and now we're having thousands. So it's just an indication of where this epidemic is at the moment. My concern as somebody who is managing the program is that we need to be doing more testing, and we need to be having more people on treatment, and our numbers are it's just not right there at the moment. So we need to get smarter, as Dr. Emali said, and get smarter about the way we're doing things so that we are using limited resources really well and getting on top of the epidemic faster than we currently are.
Let's talk about injectable drug use. We know drugs has reached a crisis point in Fiji. Methamphetamine is rife. Cocaine is found everywhere. We're now getting drugs washed ashore along the maritime islands. We had the Tuinaiao and Tuilau raising serious concerns. These things are washing up on the shores of the villages who eventually, if we do not act quickly, will either end up dealing it or using it. And we know that used needles are being found everywhere. We know that this is becoming a major concern, that sharing needles is a major concern. What are the stats telling you about injectable drug use?
Yeah, thank you, Vijay. You're right. Drugs has has always been in Fiji, but it's the type of drugs that have introduced over the years. That's what's changed. And the method at which we're injecting in the country, some of it is not unique to Fiji, but there are certain practices that are being practiced here in Fiji that makes it a more dangerous practice, in terms of health. A rapid assessment was conducted by researchers last year, in February last year, and it's the only formal research that has been done here that is of good evidence. But the problem with it was on a small group of people and only focused in Suva. So we don't really know about the practices of drug use in the rest of the country. But what we know from that study is that, as you pointed out, the unavailability of sterile needles and syringes means that whatever is available, people are actually sharing. In fact, in countries I have worked in where needle and syringe programs exist, needles, as you've been described, I've seen in places where people are injecting, like discarded needles. It's so uncommon here in Fiji. In fact, the media has probably highlighted very limited cases of when, needles and syringes are, and it's only the case because needles and syringes are difficult commodities to get a hold of because it is seen as an illegal item and therefore unavailable in the country. So whatever is available, people are holding on to it. And ideally, when they use a needle and syringe once, they're using it multiple times on themselves and then often sharing it with friends and family. So as a result of that, any virus that is in that used needle and syringes gets transmitted to somebody else. What is unique about the way we inject drugs in Fiji is we inject in groups where we might share the needle and the syringe with a group of people. And this is what is quite alarming for me as a person that's from this country, is that we're not injecting with strangers. We're injecting with close friends. We're injecting with family members. So in any one injecting episode, you will be infecting your family members and your friends. And then you go home and you sleep with your sexual partner, or you might share with another group of people, and you see how very quickly this epidemic becomes a big problem, and this is why it is exploding, because of the way that we are actually practicing drug use here. Some of the other things that the study has identified is that we're using our mixing equipment and we're sharing. So it's not just sharing of needles and syringes, it's sharing of the mixing equipment, because we're buying crystals and the crystals need to be diluted, and people are sharing the diluted equipment with each other, and oftentimes it contains blood which has viruses in it. So it's not just HIV that is an issue for us, it's also hepatitis C, which is a new problem this country has to face. Unlike HIV, there is no treatment for hepatitis C, and anyone that is infected with HIV and hepatitis C is most likely going to die as a result of hepatitis C. But hepatitis C is treatable, and it's available. Hopefully it'll be available soon in Fiji. We have guidelines written for that. I think I just want to highlight all of this because it's not just HIV, and it's not just drug users we're talking about. Our traditional mode of HIV transmission is sexual transmission, and 50% of all our cases in this country are transmitted through HIV through sex, either heterosexual sex or men who are having sex with men. So if you're not using drugs, you're going to be infected through sexual transmission because the condom use in this country is really poor. So, it's a big issue and something we need to get on top of.
What are your thoughts on, we know there's a rising case and studies are showing us that injectable drug use, sharing of needles is becoming a big concern in Fiji. What are you seeing on the ground?
Thank you, Vijay. Yes, that is like Dr. Jason has said, the study that was conducted, and we are also getting insights from our communities as well that we work with. What is happening on the ground, the sharing of needles, the sharing of equipment, the sharing of blood. It's just because the syringes and the needles are scarce. They are not readily available for them to access and use it for themselves, and they are in the habit of sharing. If we do not, other countries have this program, the needle syringe program within the country that responds to the reduction of HIV within injecting drug users. It has worked. It has shown there's evidence that it reduces the number of HIV. This is where the program involves distributing needles and syringes to drug users. It's not promoting the drug use. There has evidence that it does not promote drug use. these are already drug users. They're already on drugs, and they just need these needles, and it's it's a behavior, and without us giving that means of behavior, their behavior will not change. They will continue to share that needle and the syringes that they have access to, unless they are supplied with their own needle and their own syringe that they only use for themselves. We will not see a reduction in HIV soon, and we will continue to see an increase in HIV as well as hepatitis.
Do you think, in terms of, and you're talking about needle syringe program, and when you've spoken about this, what's the community feedback? Do you believe that the community, the Fijian society is ready for this? That if we roll out a needle and syringe program this year?
It has been a challenge to change the mindset of our communities. Especially there's a thinking that this promotes drug use. The needle syringe program, we have brought in technical experts from other countries. We have taken this to our communities, to our faith-based leaders, to our youth groups, and we have increased the awareness of this needle syringe program into our communities. And we have gotten positive feedback as well. Now they see the benefit of this program in the country. And we are getting positive feedback, and also hopefully soon we will have that available in the country as well.
Doc, what are your thoughts on it? Definitely people who are watching out there, there were some questions sent from here and also abroad about them saying they're concerned if this program comes through. What can you tell them directly if we don't have a needle syringe program?
I think I sort of highlighted this at one of the first questions you asked. We use statistical modeling, and what we've identified is that without this very important intervention, such as the needle and syringe program and pre-exposure prophylaxis, that we expect to have 25,000 people infected with HIV in Fiji by 2029. And that's a reality that's really coming to fruition now, if you just based on the data that we've just talked about earlier than this. We are realists in the work that we do, and we work with people who are becoming infected with HIV every day. And the reality is that more and more people are becoming infected, and more people are actually dying from HIV. What is really worrying is that it's transmitted to every other population group in the country. So for us, it's a reality. And we are realists, and we've been in public health. I've been in public health my whole life. And the one thing that I know works is evidence and evidence-based interventions. And that's the way Fiji should respond. As we have always done from the very beginning of the creation of this country, we have used best scientific evidence for the time to respond to public health issues. This is a new challenge for us as a country. I'm in no doubt that drugs is a broader social issue in the country, but we can't address it by putting our heads in the sand and hoping it will go away. It is not going away. Drugs is not going away. And we have never gotten rid of drugs from any country in the world, despite how strict the laws are in those countries. In countries that have the death penalty, they still have drug problems. They still have drug users, and they still have people becoming infected with HIV. You cannot get rid of HIV or any other disease related to drug use by being stringent and not putting public health interventions. There are 93 countries in the world that have introduced needle and syringe programs, and those countries are successful in addressing the HIV and hepatitis C problems. We are a resource-limited country. We cannot afford to be pretending that this issue is not for us to address. There is evidence. We have a team of people in the country. We have a lot of support from our international partners. We need to just get on with the business of addressing this as a public health problem, as we have done with every other public health problem that's faced this country.
Have you been getting support from the ministry itself and the government that we have to roll out with this program? When do you want to roll out with this needle syringe program?
The time to introduce a needle and syringe program into this country should have been about 5 years ago. That's the reality. Whenever you have a public health intervention like this that you know works, and you have a public health issue that's emerging, you must respond with evidence. And ideally, it should have been introduced 5 years ago. But this is a new public health intervention. The government is fully supportive of the interventions. We've been given full support for us to introduce it, but there are steps that we need to introduce, and that's the part that we are currently working towards. Putting all the legal frameworks in place to allow us to introduce needle and syringe program. So those of us who are doing public health work by distributing needles and syringes will not be arrested in exercising our public health responsibilities. For somebody that's looking after clinical health workers and peer educators, I want to make sure that they're protected when they're doing their work. Criminality around drug use is a serious issue. So for us, safety is another thing we need to be cognizant of, and we have to make sure that all our public health workers are protected when they're doing their work. Unfortunately, right now, because of the criminality around drug use, it is very difficult for us to do public health work around this. So for us, we need to put in place all the systems first before we can actually introduce this program. But we take our hats off and we celebrate the brave public health workers that are currently, through their own means, distributing needles and syringes to those who might need it. Because they will be the ones who will be solving public health issues while we are trying to figure out the paperwork. So we take our hats off to those people, and we hope that they will be protected in what they're currently doing.
For those who are watching out there, 67% of HIV cases in the country are people aged 20 to 34 years old. And a massive 32% are just 20 to 24 years old. Why this astounding increase among our young people?
Thank you, Vijay. That has been a trend over the past years. It's not something that we just found out from last year, but it has been a trend over the past 4 or 5 years. The increase in number of HIV cases among our youths and our adolescent age group, it is something worrying. These are our future. And, if they're being infected with HIV, we have failed in our part as a health system as well in protecting our young ones. The evidence has shown here within the country, most of our youths are involved in injecting drug use as well as, the sexual transmission as well. But the services are available, help is available, treatment is available for them to access, testing is there, and just to encourage our youths, if we know that we are at risk, please seek the care that we need, seek that test, know your status, and start on treatment as soon as possible. You can live a normal, healthy life, doing, well for the future if we start treatment early as possible.
We'll be talking about treatment as well after this. Now, 117 Fijians died last year. They had HIV, and 60% of them were diagnosed too late. They came too late. By that time, they could not be treated. That means more than 80 people walked into a clinic or a hospital, their immune system was destroyed. For disease, we have free medication for. Why are Fijians still dying, based on your analysis?
Thank you, Vijay. One of the common issues the number one challenge we have here in health is our poor health-seeking behavior of our population. It's not unique to HIV, it's right across the board. Like, we all have stories of someone who's turned up really late with diabetes, they've lost a limb, their kidneys are failing, they've lost their sight, but they could have been diagnosed years before that and put on treatment so they don't lose any of this. So HIV is the same. Many people either don't know they have HIV and therefore slowly get sick, or people might know that they have HIV and are not on treatment. And as you've pointed out, without treatment, your immune system will collapse. And if your immune system collapses, then you become very sick, or you get a cancer that you might not have if your immune system was protected. So for us, it's a combination of issues why people are not coming forward and staying on treatment. One of them is poor health-seeking behavior, but the other one is stigma and discrimination and fear for people accessing services. So oftentimes people know they've got HIV, but they don't want anyone else to find out because of the stigma and discrimination. So as a result of that, many of them may not actually come forward for treatment and stay on treatment. Anyone that's taken treatment for something, whatever it is, and you have to take it every day, they will tell you how tiring it is for you to remember to always take a drugs. People get exhausted, and we understand that. So what we need to make sure is that people have that psychosocial support to deal with these situations that arise when people are just exhausted from being on treatment. So, people just go on treatment holidays. They just stop taking the treatment for a period of time so they don't have to think about their illness. What's difficult is oftentimes people are well and they've been taking these medications for something that they don't feel like they're sick. So I think that's where counseling comes in, so people understand that even though you might feel well, the treatment is the reason you feel well. And if you go off the treatment, before you know it, you will actually be sick. So as Dr. Emali said, it's not a case that we don't have treatment and that the clinics are not there and the health workers are all there and the support services available. A lot of it has to do with individuals' experiences and also the background that they come from. So even though they may want to go for treatment, they may not have a good support system to allow them to be supported to be on treatment and care. So I think there's a lot of issues, and a lot of it is individual, whereas a lot of it is the system issue, as Dr. Emali has highlighted. So we, as people who manage health programs, our job is to address the systems issues, and we try our best to sort out the psychosocial issues, but that is oftentimes beyond our control, but we try our best.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
HIV is real in Fiji, but so is hope. The first step is knowing your status. With early treatment, people with HIV can live long, healthy lives. HIV does not define you, but your choices can protect you and those you love. Get tested. Know your status. Free HIV testing, visit your nearest health center or call 1325.
This message is brought to you by the Fiji government, FM 96 and Legend FM.
To the 27th of June, Fiji Showcase 2026 at the Vodafone Arena. Suba! Fiji Showcase, Fiji Showcase.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan, and we're here at the home of Fiji Showcase 2026. You can hear all the noise in the background, and we wanted to take the show out to you, the people who are around here, and also come out of the studio and to talk about this issue that really matters, HIV. And we've got Dr. Jason Mitchell and Dr. Emali Druma with us talking about this. Now, for those who are watching this, some of them may be thinking, or a lot of them may be thinking, this is not my problem because I don't have anyone who I know has HIV. I don't know anyone who may have HIV. And this is for those, or it's a them problem. It's not my problem. What do you have to say? How does this affect everybody, Doc?
Thank you, Vijay. There used to be a time in Fiji when it was someone else's problem, and it is now, the situation has grown so much so that it is now our problem as a country, and it's something that for us, as far as we're concerned from the HIV program, we cannot address this without the whole community being behind us, because it's a collective effort. I think the reality is that if you don't have HIV, you will know somebody who has HIV, whether they tell you or they don't tell you. There are so many people who have HIV in the country now. It's impacting our older generation, the younger generation now, and babies are being born with HIV. And there's lots of people who will be infected. So one way or another, we will all be impacted by HIV. This is everyone's business. Like I said, like every other health problem we have had in this country, we have risen together as a country to address it. And HIV is going to be one of those where we have to work together as a community and as a country to address this. And I think this is the most important message for all of us, is that we all have a responsibility not only to ourselves, our smaller nuclear families, but the broader community in which we live in. So if it's not yourself, it might be your children or your grandchildren or somebody in your church who might be impacted by HIV. So it's, something that we all share and something that we need to be working towards.
Why is it important for everyone to care about this issue rather than saying this is only for those who have HIV or the families that are dealing with it?
Yeah, Vijay. Yes, it is everyone's problem now. It's ours. We cannot be blaming it's them or it's us. It's not us, it's them. We have to work together now. It's not just going to affect the health system of the country. It's going to affect our economy as well. Just yesterday, I was going through my Facebook and I saw in this page where the tourism industry, and there was a post there that says, "Beware of HIV in Fiji." All of the other countries are talking about the rapid increase of HIV in Fiji. So it's definitely not, it's not the time for us to be blaming that it's their problem. We have to take ownership of, if we love our country, we will, help in every way that we can to try and halt and stop the rise in HIV infection. So, it's not just about, it's the health system, it's the Ministry of Health. No, it takes the whole government, every other ministry, every other partner organizations, our civil society organizations, our villages, our communities to work together and try and get this epidemic controlled.
We already have a limited number of beds. Let's talk about if a health system gets overwhelmed. We know that when people are untreated and have HIV, they can have multiple complications. They can be bedridden maybe for weeks, months. What does that do to our health system, which is already struggling, Dr. Mitchell?
Yeah. Thank you, Vijay. I mean, it's for those of us who've been working in HIV in Fiji, we are always concerned about how this will impact the overall health system, given that our resources are limited and our health system is already struggling with other health issues. From all our clinical colleagues in the hospital, all of them are sharing concerns about the number of opportunistic infections and cancers that they are now having to manage. And this is on top of existing health issues. Mind you, people living with HIV don't just have HIV, they have every other opportunistic infection that they might have exposure to. They will have diabetes, they will have heart problems. All of those things are still issues that they need to deal with. It's not just HIV. So the burden on the health system is already being felt. Unfortunately for us, data in Fiji is not great, and we can't say for sure how much impact this is having on the health system. But if you talk to any clinician, and we are public health people, so we talk to clinicians all of the time to tell us what's happening in the hospitals, and all of them are sharing how many cases they're managing and how long they have to be in the hospital. So there's always a competition for beds in the hospital, always. If you for any particular hospital, like any ward you go to in the hospital, there's a shortage of beds. You don't want something that can be prevented by treatment to be the cause of bed blocks in the hospital. So for us, it's important for us to invest in the treatment program so that it doesn't put a burden on the hospital, and we're not dealing with opportunistic infections or cancers that can all be prevented with good treatment. So for us, from the public health side, we have clinics that are available to get people on treatment. But if they don't use those services, or we're not effective in delivering those services, then you end up with people being in the hospital. And if you talk to people who are managing St. Giles, you talk to one managing the skin clinic, or talk to people in the TB hospital, they will tell you that they are under a lot of burden because of HIV. because a lot of people who shouldn't be in those beds are in those beds now because of HIV. So for us, it's something that we are trying to get on top of because it will reduce the burden of the overall health system. It's here. It's already impacting us right now. So it's not an if or when situation, it is here. But if we don't get on top of this, it just gets worse and worse and worse and worse. And I think this is something that we keep saying. This is just the beginning of it. If we do not get on top of this, everything gets worse. And as Dr. Emali said, like the government is very concerned about how HIV is going to impact the economy. A number of our close tourism partners are already warning their citizens that are coming to Fiji to be aware of the HIV situation here. If we don't show leadership and respond effectively to the epidemic that we are experiencing here, the tourists will stop coming. If I'm traveling with my family, I need to know that where I'm taking my family to, the hospitals are able to manage us if we get sick, that my the tourism industry, the people that are serving me in the hotels are well, and they're not going to infect me because of TB or something else like that. It's important for us to respond effectively as a country. And so that's why our message is really, this is not something that health can manage on its own. We need the whole country behind us and all of us working together with a shared objective that we will respond to this epidemic as we have done with every other epidemic we have faced as a country.
We need strong and decisive leadership to ensure that we are in a crisis here. And this is where the tough decision needs to be made on how we manage things. We put the issues first that matter for our people. If our hospitals are already getting overwhelmed, our health workers are already getting overwhelmed, we should know that this is what we will be affected by when you need that bed and is not available. So it makes clear sense. The other thing, remember, our biggest our foreign exchange earner is tourism. And if we start getting our tourism numbers low based on these issues, it will have a devastating effect. Now let's talk about the survival rate. According to the HIV statistics, we have only 56% of diagnosed people on treatment. That means around 44% of people diagnosed with HIV are walking around with the virus untreated. Why about half of the people are not seeking treatment?
Thank you, Vijay. Around 44%, as you said, are without treatment. Now, there are patient factors. There are individual factors that are leading to this data as well, and also the system factors as well. So for patient factors, like Dr. Jason has shared, the support system that they have at home does not allow them to access those services. And it might be financial, it might be geographical, where they are living far away from the clinics. They are not having that finance to have, pay their bus fare, pay their taxi fare to come to the hospital. Those are some of the patient factors that we can have. It's also a very common barrier that we have, not just in Fiji, everywhere in the world with HIV, is the stigma and the discrimination. So stigma, it's not only just faced out there by the communities, it's within our health system as well. They don't want to be identified as visiting a HIV clinic or sexual reproductive health clinic. They don't want to be identified, as taking this medication every now and then, every day, within their family. So stigma is a huge barrier that we need to deal with as well, that we need to understand. And just having that support system at home, that knowing that they know that, the family, I am here, I can support you, you need to take your treatment. So we need to talk about this within our family as well, within our communities, how we can support those that are affected or infected with HIV as well. And of course, the system factors that is our responsibility of improving within the health system, of how we are able to provide that friendly service, we are able to supply that medication, we are able to get that testing services there out there in our facilities. That's where we play that important role.
Do we have the medication in stock?
Yes, we do. We do have the medication in stock. Might not be all the time, but that is what the program, the unit is aiming for, that we do not run out of stock of these medicines. That has been a history with the Ministry of Health on the stock of our medications. We do not have that expertise of forecasting well of the medication. The number of the data that we have, we do not keep a very good data, with the system that we have as well to enable us to tell us that this is how much I should be getting. But we are working towards that, and we are trying our best to ensure that the medication will always be available.
Let's talk about that. You're moving from your big hospitals. Before, you could only go to the big hospitals, and now you're going to subdivisional care teams. More places are available for this. Can you explain how things are changing to ensure that you reach out to the people more?
Thank you, Vijay, and thank you for highlighting the new approach that we're trying to introduce. In the early days of the HIV epidemic, all we needed were 3 clinics around the country because our numbers were so small. But given that the epidemic is quite large now, we can't replicate these clinics all over the country. So what we're trying to use is what with the primary healthcare system. So we have 21 subdivisional hospitals in the country, and the way that HIV treatment and care is delivered in this country is through HIV care teams. So it's a group of healthcare workers that we train to provide HIV care and treatment. And so right now there are 14 subdivisional care teams around the country that are able to diagnose and put people on treatment for HIV. This means that we are bringing HIV care and treatment closer to where people are actually living. Now, that's not to say that you can't access services elsewhere in the country. What we learn from our population, and oftentimes if it's closer to your home, relatives are people who are providing care in your health facilities. So what happens is people don't want to go to those health facilities, which means that they have free option to get on the bus and go to another clinic far away where they don't know anyone and they don't know them, and they can go on treatment there. So what we're trying to introduce into the country is different models of which we can reach people. The country is going to be investing in one-stop shop buses, which we will be working together with the TB program and the sexual and reproductive health clinics to move close to where people are through working with our peer educators to reach out to people and bring them to the buses, where they will have lab facilities. They will also have pharmacy facilities so that they can have access to diagnosis and treatment and counseling for HIV closer to where people live. So we're trying to be innovative in how we approach this, because clearly, as Dr. Emali has said, what we were doing previously is not sufficient for our country at this point in time. So we need to introduce different ways of reaching people and making sure that they remain in care. Now, as you mentioned, 55% of people are diagnosed with HIV, know that they have HIV and are enrolled in care. But a conversation we're not having is that a lot of those people are dropping out of treatment and care, which is again not unique to HIV. It happens in TB and all sorts of other health issues, malaria and hepatitis and heart problems. People go off their treatment for various reasons. Oftentimes it's because somebody's convinced them that they can pray their way out of it. Someone's convinced them they can drink some magical green juice and they'll be cured of this. This does not happen in HIV, and does not happen in other health issues. You need your medication, you need your green juice, and you need your prayers. You need all of it working together. So what happens oftentimes is people get on treatment and they fall out. Our job now is to find people who have dropped out of treatment and re-enroll them in treatment and make sure that they stay on treatment. So I think a lot of it is education, a lot of it is psychosocial support. So we want to make sure that's available to everyone. But this is a specialty skill set which we don't have in the country, and we're trying to see if we can get mobilization to have more people enrolled in our treatment and care services and trained to be able to provide care for people who are on long-term treatment for HIV.
We see that HIV becomes quite an uncomfortable conversation. A lot of emails there and messages that I received, people did send a lot of questions, but they didn't want to come and stand up and ask the question themselves, or did not want to come here in person. We understand that it can become uncomfortable. Now, just in line with that, knowing that the stigma and people not wanting to come forward and maybe talk about it, we know that the issue about medication, as Dr. Emali has said, what kind of support do you need? Do we always have HIV medication readily available for people?
I think maybe just to add to what Dr. Emali has already highlighted, one of the things that we have done under the guidance of our minister, a directive was sent by his office to create this program that we have set up. And it's intended to respond rapidly to this evolving epidemic. And so as part of that initiative, we have dedicated clinics that sit under the unit. We also have our own procurement system. So it has been removed from the usual ministry procurement system. We create our own. This gives us a bit more control and a bit more ability to forecast well, so that we don't run out of medication if the reason for that shortfall is because of poor forecasting. We're addressing that by training the right people and having the right people embedded across the ministry to make sure that, you know, we are always on top of our numbers around our commodities or the, you know, the things that we need for HIV treatment and care. So we're introducing the system. It's going to take time to set that up. We have a warehouse now in Suva, and we need to have warehouses in the rest of the country so that there's always drugs and test kits available closer to where our services are being provided. We also need to make sure that all the subdivisional care teams that we're setting up have the right pharmaceutical support, so that we can have pharmacies that are able to receive HIV treatment and care, and that's available when people are there, when they actually come into the clinic.
So if I'm in Nosori and I'm living with HIV, I've been tested and I need antiretroviral drugs, how quickly do I get it after I get tested positive? Is it in days, in weeks, or in months?
Ideally, it should be same day. They should be receiving the antiretroviral drugs at the same time. That's after the counseling session, and depending also on the acceptance of the patient ready. The patient is ready, or the person is ready to take the medication. So this is where counseling is important before the test and after the test as well, when they receive that the status. Medications, like Dr. Jason has said, previously were just available at the 3 hubs or the sexual reproductive health clinics, and through this program of decentralizing our services, it will be available soon at the different subdivisional hospitals as well, even up to the health centers as well. And there are processes that we need to do. You know, we need to train our healthcare workers, because this is more like a specialized service that they are going to provide for our HIV cases as well. So they have to be ready, the officers have to be ready, the facility has to be ready. That's taking into account the pharmacy, the lab people, and also our nurses and our medical officers. So it's a process, but you know, it's something that we have highlighted, or we have noticed that it should happen. And very soon, with the procurement and a warehouse, you know, all of these HIV commodities will be solely responsible under our program and our unit, and this should be efficiently providing the medications to our clinics and for our service and for the patients to access readily.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
HIV is real in Fiji, but so is hope. The first step is knowing your status. With early treatment, people with HIV can live long, healthy lives. HIV does not define you, but your choices can protect you and those you love. Get tested. Know your status. Free HIV testing. Visit your nearest health center or call 1325.
This message is brought to you by the Fiji government, FM 96 and Legend FM.
In a world where opinions are loud and facts can fade, there's one voice in Fiji that stays true to the truth. For 40 years, our news team has brought factual and reliable information on our 5 radio stations: FM 96, Legend FM, Naftarang, Viti FM, Radio Sargam, and for over 2 decades, Fiji Village has been where credibility lives, connecting Fijians to the stories that matter most. With over 3 million monthly page views and a growing digital reach across Fiji and beyond, Fiji Village delivers news
as it happens when it happens. The news, sports, in-depth talk shows, explainers, special events, entertainment, business sections, video features from our 5 radio stations and live radio all come together on this live and engaging platform. Through our flagship show Straight Talk, we bring the nation's most important voices, the people of the country and the leaders to the forefront, creating space for dialogue, accountability and change. From breaking stories to community campaigns, Fiji Village has become part of the fabric of everyday Fiji life. For businesses and brands, partnering with Fiji Village means more than just visibility. It's credibility. Fiji Village, Fiji's most trusted digital news source. Real people, real stories. Fiji Village, your trusted news provider.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guests tonight are Dr. Jason Mitchell and Dr. Emali Druma. We're talking about HIV. We're here at the home of Fiji Showcase 2026 at the Vodafone Arena. And how much of a national priority is HIV? Well, it's already affecting our health system, and we need to ensure that we take action. Now, the other issue that is very concerning, and we continue to get these cases where women who go for their tests, maybe when they go for their pregnancy tests, and they find out that they are HIV positive. Of course, we have interviewed some of those people, and these are mainly people who have been loyal in their relationship, have been faithful, and all of a sudden they hit with this news of they have HIV. And then most likely they have the threat or the risk of their children having HIV as well. Of course, there's medication available, which you can talk about, but a lot of it also is linked to gender-based violence and other factors where this results in more people getting HIV. If you can talk about what's happening on the ground in relation to that, Doctor.
Thank you, Vijay, and thank you for highlighting that particular issue. It's something that, as I said, there's many things that health cannot address on our own. One of the issues that we are grappling with here in this region, and Fiji is one of those countries that has a serious problem around gender-based and intimate partner violence. And that often leads to sexual partners who are unempowered and unable to negotiate safer sexual practices, or to ask partners to engage in safer drug use, for example. Many of the women who are positive with HIV in pregnancy speak of the risky behavior, not of themselves, but of their partners. But they are physically unable to negotiate with their partners to use condoms if they're having other sexual partners, or to utilize sterile needles and syringes when they're injecting. A lot of these women are becoming infected during pregnancy or even before pregnancy. A lot of their children have been born with HIV. Last year alone, we had one child being diagnosed with HIV every week, and one child dying every month from HIV. So it's something that has jumped over generations of people. Within families, people are becoming infected with HIV, and a lot of this speaks to your question. It's not just pregnant women, of course. There are young people who are not able to negotiate safer sex. There are young people who are unaware that their practices around drug use is not safe. From us in public health, it's about informing people about safer practices around drug use or sexual practices, and that's something that we're trying to introduce from a program perspective. So this is something that maybe we'll probably talk about after this, but it's something that it's our responsibility to introduce and provide support for people in our community who are vulnerable towards HIV.
Gender-based violence linked to it, and we need to be talking about it in a holistic way. Just going back to the statistics about babies born with HIV and the babies that are dying from that. If you can just talk a bit more about it, I'm sure people are interested about that.
I mean, this has been in the media for a while now, so it's probably nothing new. But I think what I want to highlight is that all of this is preventable. HIV a lot of babies are being born to mothers who are positive every day, and that's because the mothers are on treatment, and if they're on treatment, their viral load, if suppressed, the babies are not able to become infected with HIV. So it is possible for us to prevent babies being born with HIV. So for us, the fact that we had 51 babies born last year with HIV gives us a serious concern about what is happening not only within the health system but outside the health system, because there's only so much that the health system can actually do. A lot of it falls into the realm of the parents' responsibility to take protections for themselves so they don't become HIV infected. And from us, from the HIV side, from the health program side, that's where we have interventions that people have access to. So I think the main point here is that all of this is preventable, and that we need to have conversations about how we as a community can be putting our heads together to prevent any more children from becoming infected with HIV.
And definitely it starts off with talking about it and knowing what's happening. Now let's talk about PrEP, the prevention pill, and I'll go to Dr. Emali first, and also like Dr. Jason to make comments on that. If you can talk about the prevention pill and even the injection that lasts 6 months, what is available, and if you can talk to the audience about that, please.
Thank you, Vijay. So PrEP, this stands for pre-exposure prophylaxis. So it's a medication that a HIV negative person can use or can take to prevent them from acquiring the HIV or the virus. We have this available in country as we speak. We had initiated this about 2 weeks ago, and we have had a first 11 individuals who were started on PrEP, and we are grateful that this is a game changer for the country. We never had this available. It was only available for certain groups, serodiscordant couples. So we are also soon be introducing the injectable form. Like you said, this is a twice-a-year injection, so you get an injection every 6 months. And PrEP, or the pre-exposure prophylaxis, it has over 90% protection of acquiring the HIV infection. So those who are at increased risk of getting the virus can access this PrEP or these medications from sexual reproductive health clinics, which is our 3 clinics out here in Suva, in Lambasa, and in Lautoka.
So let's talk about this prevention pill, and what are the practices around it to ensure that you do not get HIV?
I think what's really important, Vijay, is to understand that, like every medication, it is a medication you're taking. There are rules around its use. And anyone that's taken family planning pills will know this, that it's protective if you take it every day and you follow all the rules around its use. And just like PrEP, it's the same thing. So if you're taking the tablet form, you take it every day until you go off it. And the injection is the same. You need to have that injection every 6 months. Otherwise, it's not going to be effective. This makes it very difficult for people who are not very good with taking their medications, and there are a lot of people among us, and myself included. Sometimes if I have to take antibiotics, sometimes I forget to take the 6 o'clock dose, things like that. So it happens. There are things that you can do if you forget, but this is where your healthcare workers come in, and they can counsel you on what's the best practices for you to be using when you're taking PrEP. So for us, we are excited about Fiji having access to the once every 6 month injection, because currently there are only 8 countries in the world who have access to this. And thanks to some of our great supporters and friends from around the world who've supported Fiji's request, we will soon have this available in the country at the end of the year, and we will have that available to anyone that wants to go on a long injection form of PrEP, and that should be available to us free of charge from the Fiji government.
So if this stops transmission, are we planning to have a mass vaccination drive or a mass drive to ensure that this will solve some of the issues that we're facing?
So what we're trying our best to do is create an interest around PrEP. Anything new to the country, it takes time before people catch on to that its availability. So we're hoping through, our coconut wireless and the word of mouth for people who have started already taking PrEP about its benefits in terms of preventing HIV. So, what we need to be doing is, creating an interest and a demand around it, and then we need to do our part from the health side to make it more widely available across the country. Many countries around the world, you have to pay for PrEP, and whereas in Fiji it's free. I don't think we realize just how lucky we are in Fiji to have free access to health services, and so HIV is the same. We have free access to treatment, free access to prevention interventions, and we almost knock ourselves out trying to make prevention available to as many people as possible in the country. So, it's available. Find out more about it and try and get yourself on PrEP if you're able to.
Dr. Emali, you're using peers, street dwellers, inmates, and young people. Is the peer workforce large enough and funded enough to actually find these hidden cases? Or these peer workers are just volunteers and they're burning out trying to assist your groups?
Is it enough? Definitely not. We need more of our peers within working with us in this response. Like I said in the beginning, Ministry of Health cannot handle this alone. And I've come into this space very new to this area of HIV, unlike Dr. Jason and most of my colleagues who've been in this space for a long time. And I've learned a lot. And one thing that I've realized is the value that our communities play in the response, which is, the peers, like you said. We work with our civil society organizations. They get very limited funding. They get very little support from the government. It's out of their passion that they're going out, that they're thinking about their communities. They don't want their communities to be affected, and they're going out of their way to provide these services. They attend our meetings. They are very active and actively contributing into this program, and it just opens my mind and see the value that they give in this response. And like other countries, community-led program is very important in a way of addressing HIV crisis within our country. Without our communities, we will not get anywhere. And this is where they play an important, and hopefully, with the funding as well that the government would be able to support with our communities, our partners, our community-based organizations are out there, and they will get more support and more resources in reaching out into the communities where us, the health workers, cannot reach. They easily reach, and that is what we really need to value, and we really need to support them as well.
And we did get a lot of questions, and most of the questions people wanted to know the answers, but for me to ask them, so I've weaved them into the questions that I'm asking. And one of the things, Dr. Mitchell, that was said, if we don't fix this now, if we keep losing people to stigma and late testing, what will Fiji look like in 2030?
Thank you, Vijay. I think I've reflected already on the number that we're concerned about. 25,000 people will be infected with HIV. And that's always a concern for a country with limited resources. It means that 25,000 people who are not on treatment probably, and probably infecting other people. So, the epidemic could really become overwhelming. We don't have to look far to see what happens when you don't attend to a HIV epidemic. If you look at sub-Saharan Africa, those are classic examples of the type of epidemic that Fiji currently is facing. There is no other country in this region that has the kind of epidemic that Fiji has, not even Papua New Guinea. It is a generalized epidemic, which means it has gone beyond key affected population groups and is now part of the general population. This is significant. I've been working in over 20 years for HIV, and I've never worked in a country which has a generalized epidemic. I've always worked in countries which has a concentrated epidemic, which means it's only in certain groups in the population. So for me, it's really stretching my brain to try to figure out how do we respond to this particular epidemic and in a unique Fiji way. And a lot of this is limited because we lack capacity in the country. And in the region, all the support we are getting, a lot of them come from a totally different epidemic, and they also have very little experience around a generalized epidemic that is in the Pacific. So it needs a couple of special heads and hats and lots of passion, as Dr. Emali talked about, because it requires thinking outside the box. It requires digging deep. It requires being an activist when all you want to do is just do your work. I'm a program person, and I spend all my time trying to convince people that this is an issue that the country needs to be paying attention to, because I can see where we're heading. Because we're just not on top of our prevention, and we're just not on top of our treatment and care programs. So it doesn't really matter how much resources government gives us. It doesn't really matter how much the Australian government or the New Zealand government or any other government gives us. If we don't put the right interventions in place, this is going to get worse and worse. And that's the future that we are seeing right now, is that we don't see a light at the end of the tunnel. We're in the tunnel, and it's a dark tunnel, but there's no light at the end of the tunnel. And it's only because we don't have the right interventions. We're not putting the right models in there so that we can have some hope by seeing a light at the end of the tunnel. But like I said, we have always risen as a country, and we just need people to be behind us and supporting us in everything that we need to introduce into the country. I think as a community, as a person that belongs to multiple communities in one person, I understand the complexity around HIV, and I know how difficult it can be. But there is more and more support every day. We get more and more people in the field who are able to provide support, somebody you can reach out to provide some guidance around what you need to be thinking about and doing as an individual. And I think this is just something that we need to be cognizant of. Yeah.
Dr. Emali, what if many people out there, if they continue with like it's business as usual and do not tackle this issue head on as a country?
Thank you, Vijay. Yes, like we have been mentioning before, it's not just going to affect the health system, it's going to affect our future, it's going to affect our economy as a whole as well. We will have to treat more, complicated cases, spend a lot that we could be spending, for improvement in something else or betterment of the livelihood of the people of Fiji, but we are spending in getting treatment for our sick people. So if we do not take this seriously, if we do not, take that bold step and say that this is what we need to do, the evidence is showing this. The evidence is showing that this is working for other countries. Let's go ahead and start with it in Fiji. And if we do not work together as well, our communities, our stakeholders, our ministries, our government, in 2030, it will be in a worse situation that we are in right now.
Now, we've got the budget announcement on Friday, the national budget announcement. We had, for the first time ever, the government gave $10 million. Before that, when I was looking at the budget books, it wasn't even close to $1 million to HIV, and that for many years. So this whole issue has arisen to this point that the government decided, okay, we need to give more money. So $10 million budgeted in the current financial year, which ends at the end of July. August 1st is the new financial year of government. Dr. Mitchell, what is your expectation for the 2026-2027 national budget, knowing that this is one of the main priorities for us?
I actually don't know what to expect from the government. We struggled to utilize a lot of that $10 million that you've just referenced there. We have faced a number of barriers in making access to utilizing that money. As you've highlighted, when I first started working in HIV some 20 years ago, our annual budget for the country was $500,000. When I returned to Fiji in 2024 to work in HIV, our budget was $200,000. So the leadership and the boldness of our government last year and this financial year, last year, announcing $10 million up from $200,000 is significant. And people joked to me immediately and said, good luck spending that money. And at first I thought that's such a negative thing to put on me as somebody that's leading the response. But it's come with significant pressure on our team because there is so much for us to do and we need resources to do that. And that $10 million was barely touched in the last year or so. So, you know, as we all know this, when you don't spend money government gives you, you can expect that money to be cut the next year. So I don't know what the answer is, what the budget will be announced for the HIV response at the end of this week. I'm just as interested as everyone else that works in HIV program. All of us are concerned because we are just ramping up our response, and so we need access to all those resources. The cost of a good epidemic, as I said, a good epidemic response is in the millions and millions of dollars. The cost of testing, the cost of treatment is expensive. The cost of our prevention interventions is not free. It's going to cost somebody money. The human resources that are required for this response is estimated to be about $4.5 million for government alone. This is not including the support that Australia is giving for the peer educators that are being paid by the Australian government. That's not covered in the $4.5 million. So my concern that they will cut our budget is really alarming to me, especially when we're just picking up our response. So let's see what Friday comes. But there's just no way about it. You know, the government has to respond to this epidemic. Otherwise, it will be remembered in history for not being the government that would be responding to this epidemic with the right resources. And this is something we are concerned about.
Again, decisive leadership and put your money where your mouth is, because the national priority definitely staring at us. Everything connected, as Dr. Emali was saying, our economy, the message in terms of the tourism advisory going from the other countries that watch out if you're coming to Fiji. We need to ensure that we tackle this head on. Now, this goes out to both of you before we finish off. If a young person is watching this out there, and they may be terrified, and I've had this experience when I do these shows, mainly regarding HIV, sexually transmitted infections, where people do not want to have those conversations. It still remains a taboo subject, where people even send in their questions and keep reminding that please make sure you don't mention my name. So for the people who are watching out there, I'll start off with Dr. Emali, who is terrified to pick up the phone maybe. What is your final message to them to get them into that clinic tomorrow morning? What do you say to them and also to their close family members?
Thank you, Vijay. To everyone that is watching this show, we thank Vijay for inviting us to this show. You know, I think the scariest thing would be for a person is the uncertainty of not knowing their status. You know, the services are there, the testing services are available. You do not have to come back after 2 weeks or a month to get the result. It's on the spot, you can get your result. It's free and it's confidential as well, and there's treatment available. There's also counselors who are there, support services that are available in the clinics as well to provide that support service for you. You won't be alone. We can definitely say that. You know, we have peers who have gone through the same experience, who are willing to support anyone that comes with you know, this new diagnosis of HIV, and also to the family members or to the relatives. It's very important of how, you know, we talk openly about HIV, like you said as well, and STIs as well, but especially with HIV, the support that we can have for our family member. Creating that stigmatized space and discriminating a family member will not help them, you know, access those services as well and do well as well in their livelihood. And just offering them that advice that, you know, whatever the result is, I am here for you. And knowing that, you know, we will get the support that you have. So encouraging our public, you know, the services are there. that we come and make use of the services that are available, and also support our family and friends who are going through, this life-changing diagnosis. Thank you.
And Dr. Jason, just in relation to people who may be watching this, your message to them, how important it is to go to the clinic if they feel that, they may be victims of stigma and discrimination, also the counseling and other things that services that are available, and just a general comment to the people out there who may still think this is an issue that is not relevant for me because I'm not affected. What's your final comments?
Thank you, Vijay. And again, I echo Dr. Emali's thanks to yourself and to your team for having us here on this show, especially at the showcase. Like, you could have had anyone, but you've agreed for us to be on the show. I don't know if I could add anything more to what Dr. Emali is saying, but one thing that I keep talking about, and I'm trying to get a movement in this country, HIV is preventable. But I think a lot of success in prevention comes towards the individual. It's about identifying what your individual risks are, what your individual vulnerabilities are, and you need to reach out to the right people to talk about what those individual risks are and vulnerabilities, and come up with a package of solutions that are specifically for you. I cannot sit here and tell you, you need to use a condom, you need to go on PrEP, you need to use needles and syringes that are sterile. It's about an individual's risk and vulnerabilities, and you can only have those conversations if you're talking to the right people. And as the days go along, we have more and more people out there who are peer educators, who are peer outreach workers, who are nurses and doctors, who are able to have these confidential conversations with you to build your own capacity, give you skills and behavior change skills for you to reduce your risk towards HIV and other STIs. And Dr. Emali highlighted this. There's treatment that's freely available, but we appreciate that it's difficult for people to go on treatment because it raises questions in the home. What is this tablet that you're taking? Why are you taking those tablets? And people tell us this all the time. So again, to family members and to people who are in our communities, we need to start talking about this openly and acknowledge that HIV is here, and this is just like any other infection. Yes, there's a lot of information and noise out there about HIV, and we created a scare in the community, but we need to address this as a community, and we can only get on top of this if we do this together. And I think there's probably nothing more I can add to what Dr. Emali said, but other than to say that there is more and more people out there. Do not do this alone. Reach out to loved ones, reach out to friends, reach out to colleagues in the office. I mean, we all get tested in the office sometimes, and it's scary. Like, I'm someone who is the lead of the HIV. Imagine if I'm sitting in the office and my test becomes positive. That is always a fear that I face every time I get a HIV test. No matter who I go to in the country, they know who I am because I'm on the TV and the newspaper all the time. But I'm always concerned that my result will become positive because I can accept there's a lot of stigma and discrimination and a lot of judgment in our community. If you just look at Facebook and social media, there's so much criticism and so much judgment. I don't know how we've become a country that leads this in this way, but it's not great. It doesn't create a supportive environment for us. And that's the challenge for us. We keep telling people, come forward. But at the same time, we know that there's lots of stigma and discrimination. So I share your fear, and I understand where you're coming from. But please reach out. There is somebody there who can provide support for you. It may not be us. It may be a friend, someone from your church, someone from your youth group. But there is somebody that can work with you and come forward for support that you might need.
As the chair of the National HIV Outbreak and Cluster Response, Dr. Jason Mitchell, and lead for HIV Prevention and Community-Led Program, Dr. Emali Druma, we'd like to thank both of you on behalf of our audience, our live audience here, and also those watching us around Fiji and around the world. Thank you very much. A very good conversation, uncomfortable conversation, but we need to have these uncomfortable conversations, and we will continue to have that because, of course, today the writ of elections, that legal time frame opens up. So a lot of parties will be preparing for elections as well. And that time frame opens today. If the writ is issued 45 days from that date, general elections can be held. And of course, we have the national budget announcement that is at 10 a.m. this Friday. Follow us on Fiji Village for all the latest information simplified for you for the 2026-2027 national budget that will be announced from Parliament by Minister for Finance, Esrom Emmanuel. And also, we'll have a special Fiji Village Straight Talk with the Minister for Finance, Esrom Emmanuel, next Wednesday. So stay hooked on that. We'll have more information on that. We'll also be posting up, our support crew will be posting up all the information based on what has been shared by Dr. Jason and Dr. Emali in relation to where you can go for tests, where you can go for more information, the hubs that have been set up for you. We'll have all of that information on our social media pages, captioned together with all the details so that you can take advantage of those services available to you. Take action, be responsible, and have a good evening.